Hey friendlies, I'm Carolyn and welcome back to my RV life. Doing an update today on my project for helping nomads, which I have decided to make it easy. I'm going to call it Nomads in Need, and I wanted to update you on that today. But things are kind of nuts, aren't they? Are you feeling it? It's funny, I had been trying to not get caught up in everything and just kind of go about my life and know what's going on, but not throw myself into all the panic and all the mania and all the chaos. And now that I'm doing this and making videos about it, I kind of feel like I'm more involved in it. I usually just kind of like to go about my life, be aware, but again, kind of not participate in all the drama. And I threw myself into the drama, even kind of creating some drama, as I often do when I speak my mind. But just want to know how you're all doing. Every day that I do a video, there's more going on. I just read that the United States-Canadian border is closed. I have been hearing that in addition to shelter in place in a lot of the major cities, that martial law might be implemented. And, that's a big deal. It's a big deal for a lot of us. And I can understand that people might be worried and concerned and unsure. And, it's really sad that that's where we're at, because there's just so much we don't know because we're not getting clear information. That's what I'm seeing. I'm trying to educate myself on this so that I can speak to you more clearly and, give information, accurate information. But the fact is, there is no one source. The information is all over the place. There's nothing consistent. There's nothing, what's the word I'm looking for? I hate that I can't think, but there's nothing decisive. There's not one place. Everything, it's kind of chaotic. And that comes from the top. But I do want to talk a little bit about the shelters in place, because it relates to my Nomads in Need project, because a lot of people have written to me to volunteer to help, and they're like, I'll help as long as I can, but my city is going to be shut down soon. So a shelter in place I'm going to read to you one of the sources. It's a newspaper in San Jose, California, because they were one of the first, I think, to shut down 6 counties in California. But what does shelter in place actually mean? It's all about kind of forcing people to do this whole social distancing thing. Coronavirus is highly contagious, much more contagious than the flu. What they're saying now is that if a person has coronavirus and doesn't know it, if they're not showing symptoms, they can contaminate 3-4 people. I've heard they can contaminate up to 10. It really kind of depends on how many people they're around, right? And so what we're seeing is really the tip of the iceberg. And that's why the drastic measures by cities and counties and states are in the country now, countries closing borders, and that's why that's happening. We don't know. And part of the reason we don't know is because we don't have enough tests. That I heard that North Korea is testing 10,000 people a day, and that as of a few days ago, the United States hadn't even tested 7,000 or 10,000 people. We have a drastic shortage of tests, so nobody knows. We don't know. People are exhibiting symptoms, but people aren't getting tested. And again, that's a problem with, that's what happens when you gut response teams, because we don't need them, but we don't. So that's part of the problem that's going on. But so what does shelter in place mean? I'm going to go back to that. And it just means essentially social distancing to the highest degree, where people are forced by their governments to stay at home. So all businesses and government functions not considered essential must be shut down. Public and private gatherings of any side outside a home are prohibited, and travel is prohibited except for those performing essential activities. I'm going to talk about essential activities and what those are in a minute. Operating essential businesses or maintaining essential government functions. So when am I allowed to leave my house? If you operate or work for an essential business, which includes healthcare providers, bankers, grocers, child care facilitators, and shelter operators, that is considered an essential business. So again, an essential business is anyone who is in healthcare, banks, groceries, childcare, and shelter operators. If you provide essential governmental services needed to ensure the continued operation of government agencies such as police, fire, and transportation. If you need to conduct necessary activities, and these are all in quotes, necessary activities that would include obtaining medicine, seeing a doctor, purchasing necessary supplies such as groceries and personal hygiene products, or providing necessary care and supplies to family members in another household. So that I wanted to share that because essential activities do include being able to do what you need to subsist, to survive. And that means getting groceries, taking care of getting medicines, going to see doctors, and things like that. So it says supplies to family members in another household. I'm going to take a leap here and say that if you're a nomad or not a nomad, I'm going to talk about that in a minute. I'm going to expand my little project here, my Nomads in Need. I'm going to expand it to anyone in need, and I'll talk about that in a minute. But if you don't have family, I don't see why a volunteer bringing you supplies, I don't see how that anybody could have a problem with that. The point is that it's an essential activity. You're taking supplies to someone just because they're not related. I don't think that would matter. And so how is it going to be enforced? It's unclear right now how it's going to be enforced in many areas. And again, I'm reading California. I would suggest that if you're under quarantine, if you're under shelter in place in your own community, you might want to go to your community government website to find out exactly what it means to you. This is going to be a generalization. This is going to, or it's specific to, I don't know, it's specific to this area, but I'm assuming that like things like what's essential are going to be pretty much across the board. It's an assumption. It may be wrong, but I'm just trying to help. But go to your own government website to find out information if you're unclear what it means or you want to be sure you know what it means for your area. If I didn't go to the grocery store, will I be able to get more food later is a question addressed here. If you're looking at your cupboards and are concerned that you won't have enough food to last you until the end of the shelter in place, and here it's April 7th in California, at least right now, it could be extended. You're still allowed to go to grocery stores, which will be doing all they can to restock to meet increased demand. So what else will be open? The order labels, this is the California label of essential business. And again, check to your specific area to see what they call an essential business. I have a feeling it might be pretty standard across the board. It may not be. Double check. Again, just trying to help give you some ideas, but don't take my word for it. Do your own research. Check your own local website. But this is what, under California's shelter in place for these 6 counties, what they are saying are essential businesses that will remain open. Okay. And that is grocery stores, medical facilities and hospitals, pharmacies, banks, gas stations and auto repair shops, laundromats, hardware stores, child care facilities and educational institutions, though only through distance learning. And I know a lot of schools are shut down. I've talked to friends and family in, they're like family. They're my family now. They're not blood family. But anyway, schools are shut down. Restaurants for delivery or takeout. So they're calling that as an essential service, that restaurants are open for delivery and takeout. What is expected to close? Bars, breweries, pubs, and dine-in restaurants, schools, gyms and fitness centers, movie theaters, casinos, live performance venues, and arcades. And I heard this morning that Las Vegas is going black, going dark. So, and Reno already had. So, can I still go visit my friends, significant others, and elderly relatives? The directive states that all non-essential travel is prohibited, so technically that would include seeing friends and significant others who may live in another housing unit. Traveling to care for elderly or minor relative or another vulnerable person in another household is allowed, okay? is allowed. So we are allowed to do what we're doing. If someone is in need and we have volunteers, this says traveling to care for elderly or minor or another vulnerable person in another household is allowed. So we're allowed to keep doing this for now. If that changes, I'll let you know. Can we go outside to walk or exercise? Yes. You're not going to get cited if you set foot outside for some much needed fresh air. But just still keep social distance, which I think they're saying is 6 feet. So that I wanted to provide that information because some people have been writing to me concerned that how helpful is this really going to be if people can't go outside, but people can go outside to help other people. So, or to help yourself, you can still go outside to go grocery shopping and do the essential activities. Okay, so that's kind of my update today on just some general things. Now I want to update you on where we are on Nomads in Need. This is I'm so impressed with the response that I have gotten. Helping me restore my faith in humanity, or enforce, what's the word I'm looking for? Oh my gosh. I think I might be getting Alzheimer's. It's not funny, but I don't know. I thought it was just menopause, but it just seems to be getting worse. But anyway, reinforce my faith in humanity. Okay, we currently have, holy cow, we have 36 volunteers in Arizona, California, Washington, D.C., Florida, Georgia, Iowa, Kansas, Missouri, Maine, Nevada, Oklahoma, Oregon, Pennsylvania, Tennessee, Rhode Island, South Carolina, Virginia, Washington, Wyoming, and Canada. That's right. We have somebody in Calgary. And I also have other ones. I have how many here? I have a few others who have offered financial assistance if we need it. And then I have several others. How many? I have 4 others who have already made donations. And we have already given away groceries to someone in need. And we've made 2 matches. So I'm still working. I actually got caught up this morning on all of your emails. So if you've volunteered to help, or if you have emailed me that you have a need, you should have heard from me by now. I think I've gotten through all the emails. I have a handy little spreadsheet now, and I'm working hard at matching people. So like I said, we've already given away some groceries to somebody who needed them, and I'm in the process. 2 matches have already been made. I have emails out to 3 or 4 others waiting to find out if those matches are going to work. So yeah, we're making progress. What I still need, anybody listening, I still need volunteers in San Jose, California, and Reno, Nevada. So I've got a few in Nevada, but they're mostly southern Nevada. I have someone who needs help in Reno, and I have someone who needs help in the San Jose, California area. So if you're in those areas and you can help shop and deliver supplies, let me know. No money required. Actually, if you need help with gas, I could probably help you with gas to get those supplies to them. Another thing I want to point out is what I'm asking is if I do match you with someone to help or to receive help, I need to, as this gets bigger, I need to make sure I have a responsibility to ensure that everyone is safe. And what I'm going to do to ensure that is I'm going to ask you both the recipient and the volunteer, to send me a selfie of you holding your driver's license. And your driver's license number and the picture on that license will need to be clear. I need to verify your identity so that if anything happens, I know who you are. I know where to go. I mean, of course, most people are good and kind and want to help, but unfortunately, in situations like this, sometimes it also brings out the bad people. And I just want to make sure both volunteers and recipients stay safe. So if you are volunteering to help, or you are reaching out for help, just keep in mind that that will be a requirement. I will not help anyone, and I will not match a volunteer unless I can verify your identity, okay? I'm not going to share that with the other person. It's going to stay in a file. I'm also going to ask for follow-up. So once that match is made, I'm going to ask both the recipient and the volunteer to get back to me, let me know how it went, let me know that everything is good, stay in touch with me just to let me know that everything is kosher, everything is good. And if I need to contact authorities, I know who both parties are. So that's what I'm going to be doing to ensure everyone is safe while we try to help. And again, I don't expect any problems, but it doesn't hurt to take precautions, especially we're dealing with vulnerable people. So just want to let you know that that is what I'm doing to protect you as volunteers and recipients of this program or this project, this little project that I'm doing. I'm excited. I'm really, I've been excited to see the response of people who want to help, and also the people who need help. You know, I think I said this in yesterday's video. Sometimes we all need a helping hand, and there's no shame in that. None whatsoever. So if you need help, let me know. I am also going to, I think I've already heard from a couple of people who aren't nomads. So I want to expand this. If you watch me and you're in the high-risk group, and again, it's highly contagious. A lot of people are going to get sick. Part of the problem is not necessarily with this virus that we're so concerned about the mortality rate. Of course we are. We don't want people to die. But the real concern is that people may not die from this, but people might get really sick, and we don't have enough hospital sources. We don't have enough ventilators. We don't have enough tests. We don't really even know how many people have this thing. But that's really also the concern, is that people, you know, I was focused in my previous videos on, not on how many people were going to die from it, but there's a lot more people who could get hospitalized, and we could not have the resources for that. So with that said, there is still a very high risk population. That's people who have weakened immune systems, and the elderly. Weakened immune systems and the elderly are the most at risk. That doesn't mean that they're the only people at risk. Just the people who just need to prove me wrong. That's okay. You can prove me wrong. I'm wrong a lot. I say that. I'm wrong a lot. But just because I say that those elderly systems are at higher risk doesn't mean that an 18-year-old isn't going to get it. It happens, but it's rare. So those people who are in those at-risk categories, if you need help, whether you're a nomad, whether you live in a house or an RV, anybody who needs help doesn't have... there's so many people who, especially elderly people, who are alone and don't have support system. And if that's you, if you need help, if you want supplies, if you need supplies, if you can't afford supplies, if you can't get out to the store for supplies, write to me at CarolynsRVLIFE.com. Write to me at CarolynsRVLIFE@gmail.com. Put need your city, your state in the subject line to help me manage this, to help me sort through it and match you fit faster. And if you want to volunteer, write to me at CarolynsRVLIFE@gmail.com. Put volunteer, city, state in the subject line. Those of you who wrote to me since yesterday have been doing that, and it's such a help. It's so much easier to be able to sort through. And again, I'm trying to respond to all of you and let you know that I got your email and put you on the list. And if for whatever reason you haven't heard back from me, write to me again, because I just missed it. I just had a lot of emails to go through. And okay, so Nomads in Need is now expanded to anyone in need, mostly who's in the high-risk area, in the high-risk profiles. But if you have a case where you need help, don't be afraid to write to me, and we will take it case by case. And like I said, I've already helped a couple people with groceries, and we've already made a couple matches. I look forward to making more matches. Thank you so much to all the volunteers who are, I'm just so like, I don't know. When I thought about doing this, it was just like, I don't, me, I'm not like, I do think about things sometimes. Like, I have a lot of projects. I have a lot of things I would love to do that I've thought about for a long time. But this was really just kind of a spontaneous, I'm just going to turn on the camera and talk and help people. And I'm just honored. Not honored, that's the wrong word. Happy. I'm really happy and humbled that so many of you are wanting to help. And I'm even more humbled by your humility. I hate that word, but that's the right word. In coming to me and asking for help. No judgment at all. Like I said, we all need a helping hand sometimes. And I'm just glad that I'm able to be here to connect people and to offer some assistance. And it's a scary time for a lot of people. And I understand that. And I'm sorry if my previous videos sounded callous or sounded preachy. That's not my intent. My intent is always to help. And, you know, I have very strong opinions. And I get very passionate about my beliefs. And really, though, what I want to do is help people. I mean, all I really want to do is help you feel better. I grew up a people pleaser. I grew up feeling like I needed to make everything okay, and I still carry a little bit of that with me. And I'm sorry if sometimes my delivery is harsh and it doesn't come out as intended, but I think most of you know that my heart is in the right place and that I really, I just want to be able to help. So thank you for allowing me into your world. Thank you for allowing me into your life. And thank you for forgiving me when I, you know, don't always deliver the message I intend to deliver. And keep writing to me if you need help and if you want to volunteer. Okay. I'll see you next time. I'm going to see you tomorrow. I'm going to try to get a New Zealand video tomorrow because some people might just want to be entertained at this point. And I think now that I have all of this managed, it's kind of in order, it's organized, I think I might be able to start on my New Zealand video. So thank you. Stay safe. I care about each and every one of you. I really do. And if you need anything, let me also say, I've also had people write to me who said, even if you need somebody to talk to, I have someone who is just kind of like, she's not really a counselor, but she said that she's really good at helping people. So I think I've had a couple of those who just have offered, if somebody needs a friend, if somebody just wants someone to talk to, or they just need advice or whatever, they've offered that as well. So if you just need emotional support, if you just need moral support, if you just need someone to talk to right now to kind of help you through the panic and the worry, let me know that too, because I have people who want to help you with that too. How cool is this? I'm just so impressed with you all right now. All right. So yeah, you need somebody to talk to. You need somebody to just kind of work through your anxiety. Let me know. We have people. Okay. And if you're if you're a mental health provider and maybe you want to volunteer a little bit of your time to that cause as well, write to me. Okay. So, this is kind of turning into more than I thought it would, but I think that having people on call for mental health, I think mental health is probably huge, right? I mean, many of you who are in mental health right now would agree that that's probably really needed. So, if you are willing to help people maybe through this challenging time just by a phone call, or if you're someone who is really stressing out and anxious right now and really could use someone to talk to, a professional or not, maybe just a friend or just an ear, also write to me and I will put you in touch with someone who wants to help. How cool is this? It always takes catastrophe and chaos to bring people together, doesn't it? It's sad that that's what it takes, but I'm just feeling so good about humanity. So thank you. I'll see you soon. In the meantime, be happy, be healthy, be free. Try not to worry. Take a deep breath. Go out for a walk. It's okay to go out for a walk. And I'll see you soon. Take care. In the meantime, yeah, be happy. Say I did that. Bye.